Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Bala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
It's great to have you with us again today. We are from Shoreview, Minnesota, the gateway to the north coast of the United States. And of course, we have viewers all over the world, including up in the Duluth, Minnesota, and the Iron Range, and all along Lake Superior, actually all of St. Louis County and western Wisconsin. So it's great to have you with us. We've been doing a series on whiplash and the ramifications or possible ramifications of it. And we're going to do a real quick review of it, but you can go out and pick up the previous programs by going out on our website, which is www.housecalltv.org, right?
Right.
www.housecalltv.org, and you can download a whole dimension, many programs that we've recorded over the years that are all pertinent to natural health and healing. So Dr. Jensen is going to bring up some slides here that I'm going to review for you rather quickly about whiplash and what can and what is possible to happen. The first thing we see there is a lateral or side view of a model, and very often in car accidents or car collisions, or there's a force comes from the rear, and the law of physics says the head is going to go backwards and then forward. So that's what we call whiplash, and many times those arrows indicate there is tearing, separation, or straining, or a spraining of associated muscles, ligaments, and other tissues, arteries and veins and lymphatics, as well as spinal vertebra and discs. Now the next slide here gives us a side picture of a few vertebrae on the neck at the front near the front of the screen. That would be an anterior longitudinal ligament there at the front of the throat and neck. And then those little white things there are spinal discs. And then those little dark areas are intervertebral foramina through which nerves, arteries, veins, lymphatics, and acupuncture meridians pass through from the spinal cord out to all of our tissues in our body. And then there's some tissues back there, and then there's other tissues between what we call the spinous processes that are very often injured as well. Now the next slide shows what very happens then is when the head has gone forward, then it whips backwards, and so we're seeing an illustration on this model with the little black arrows where there can be tearing at the fronts of the vertebra, at the discs, at the anterior longitudinal ligament, and in surrounding muscles and ligaments, and it's very important. Now the next one shows what happens very often when the neck and head are hyperflexed, in other words, hyper forward, that it jams and can severely compress and sprain and strain other tissues in the neck as well. And then we're going to look at another slide here that talks about some tearing at the back of the neck, where you see that black arrow, and of course the brain often is jarred as well, therefore causing emotional problems, psychological problems, or cranial nerve related issues as well. Then we're going to look briefly at some research from Mayo Clinic that is significant with reference to multiple sclerosis and Parkinson's disease. Mayo Clinic did a study of spinal subluxations that was published in August of 2004 with reference to multiple sclerosis and Parkinson's disease, that 78 out of 81 patients suffering with multiple sclerosis and Parkinson's disease recalled previous neck injuries. That's very significant, and that's why many people with multiple sclerosis and Parkinson's disease respond favorably to conservative chiropractic care. Another study that was published in WebMD Medical News with reference to high blood pressure found that manipulation of the atlas vertebra, the first cervical vertebra in the neck, lowered people's blood pressure. And the study involved at that time 26 patients who had been previously diagnosed with hypertension, had significantly lower blood pressure than 25 patients who underwent a sham chiropractic adjustment. So they had an average of 14% drop in their systolic pressure and an average of 8% drop in their diastolic pressure with chiropractic care. Then we're going to look at one more slide that Dr. Jensen spent some time in the previous program. What you see in front of you now on your far left is an illustration of the back of the skull, the back of the cervical spine or neck, and we're normally supposed to have a forward sway in the neck, and this person had been in an accident and they've lost the normal forward sway. They've lost the normal contour of the discs, the thickness and the spacing of the disc, as well as their location, as well as vertebrae are out of alignment. And the body has some abnormal compensatory reactions that Dr. Jensen is showing you there with the pointer, that the vertebrae have started to develop what we call extra bone or arthritic spurs on the front of the vertebra. And that one right there, that's called ankylosis, where the vertebrae are actually fusing together. Now, what we're going to do is we're going to bring up a slide that we've not covered before, and Dr. Jensen is going to talk about the possible symptom ramifications of neck injuries or neck problems. Doesn't have to be a whiplash or a car accident, but any problem within the cervical spine, which is called, of course, the neck. So, Dr. Jensen.
So as we look at the spine here on the left side of your screen, up here, this first area here, I don't know if you can tell, that's a bit yellow right up in here. Then we have green, then blue. The yellow part is the neck, which we refer to as the cervical spine. And the very top one of this very first vertebrae that's found underneath the skull is C1, okay? And the areas of influence that C1 or the first cervical nerve influence are the blood supply to the head, the pituitary, which is the master gland of the body. This signals everything from your change from boyhood to manhood, from being a girl to a woman. It signals a lot of that, as well as all of the natural ebb and flows of our hormones. Then it affects the blood supply to the scalp, to the facial bones. It affects the nerve supply to that also, to the brain, to the sympathetic nervous system. The sympathetic nervous system is known as fight or flight system, and so we can have it where if that has pressure on it, where we will actually feel more under stress or react as though we're under stress. And one of the interesting things about that is if we're more in a fight or flight mode, the things that shut off during stress is that it shuts off your digestion, and it shuts off your immune system, because when you are running from the proverbial tiger, as I usually put the fight or flight mode as, your body is not concerned with digestion at all of that food. It's not concerned with fighting off bacterial infections and things like that. It's concerned with getting away from that tiger, so then you have the time to heal after that. So it's going to affect a lot of these systems throughout the body.
So we could envision the brain as the main electrical computer, the main power plant.
Right.
And then that spinal cord is housed and protected within the spine.
Right.
And then the spine we could visualize as a switchboard of the nervous system.
Correct.
So if one of the vertebrae is out of alignment in a particular area, such as this first cervical vertebra,
right,
it'll affect anything all the way down.
Yes.
As well as some areas that you're going to cover now. So the part of the theoretical basis of basic skeletal chiropractic approach,
yes,
is that to find if through examination, X-ray, if the vertebrae are in alignment. If a vertebra is out of alignment, like a piano key out of alignment, then it's going to adversely affect not just the brain, but all the three nervous systems we have, as well as the different organs and system it supplies, right?
Absolutely.
Okay, so what would some of the possible effects of a subluxation or some kind of a malalignment or injury? I think you had that up on a slide here a little bit ago.
Right. If we bring up that slide, the effects include headaches, definitely headaches, nervousness, such as in that fight or flight, insomnia, colds. You know, if it shuts off your immune system, you're more subject to colds. Your blood pressure, as you just went through with that research, that the blood pressure can go up or down up to 30 degrees, actually, 30 points, which is quite significant. Migraines, which are vascular type headaches, mental conditions, such as, a lot of times, tongue-in-cheek, we can talk about an adjustment as an attitude adjustment because it changes our mental attitude so much, our mental conditions. Amnesia can be part of that. Chronic tiredness, dizziness, as well as our balance with vertigo, you know, where the room is spinning and things like that. That's quite well determined by C1 being out.
So it's possible that the so-called cold or upper respiratory infection or the flu,
Yes.
and they say, well, there's a bug going around. That's a cop-out, you know.
Yeah.
It could be that there might be a subluxation within the spine that is compromising their immune system.
Sure.
The person could have been in some kind of a trauma, an accident, months before that it's finally caught up with their the immune system just doesn't collapse overnight.
Right.
In most situations, anyway.
Right.
So the problem they have now could, in fact, have been related to some accident or injury that they've been previously involved in.
Right.
How about, do we have another x-ray that we could show people with reference to this?
Well, we refer back to this first one that we had up there where we're talking about with an accident. This is actually, if somebody's been in an accident many times, if it's not taken care of, it can progress to this amount of degeneration over the next 5 or 6 years. So a lot of times, if you haven't sought out care, you think that you're doing yourself a favor economically by not going to get care. You're just delaying the inevitable, and then later on, it's going to be worse for you.
And sometimes they have chronic problems then.
Right.
They can't recover and end up in a nursing home.
Right.
They don't want to.
You know, so many times you have people who've gotten into an accident early in life, and their body seems to have recovered fine. But then all of a sudden you hit 40 and over, and next thing you know, when you're getting up in the morning, you're feeling all of those injuries. And later on in the day, you're getting up from the floor a little bit harder than you had before, and things where it's just that you have these chronic pains, and generally they're from injuries that have not been cared for, where you've just walked them off. It's like, oh, okay, I'm fine.
Interesting, when you talk about cost control, what would it be, what would happen to medical expenses of all of the drugs, hospitalizations, nursing homes, of people who have Parkinson's, multiple sclerosis, high blood pressure if they had a chiropractic adjustment once a month?
Yeah.
You know, but because we live in this drug-oriented society where they're constantly bombarding us about take this drug, you know.
Right.
And the chiropractic profession has been largely negligent in saying, hey, this is what we can do. This is what we're about, you know.
Sure.
And a lot of these people say now, like scoliosis. I think we have a slide on scoliosis now, too, don't we?
Yes, we do. That's this next one coming up here. Shows a great deal of scoliosis. And I want to show you what's, if you're looking, this is a person that has a high degree of scoliosis, but one of the things that we find is if you look at the rib cage over on this side, see how the ribs are spread out quite wide. And the ribs on this side are much, much closer together. Now, if you look at this, is though you're looking at the person from the back. So this is their left side, this is their right side. I want you to notice that the heart shadow here is off to the left side, but the heart shadow does not look quite right. It's because of all of the squishing over on this side that the heart does not quite have much room. You look at all of this. This is actually an organ. This is your lung. So you're trying to have space for a lung and a heart on this side that because of the scoliosis, there's just not the room for it.
And I have no particular agenda other than attempted quality care is personally and professionally, over my years of experience, I have never seen anybody save money by going to a chiropractor who doesn't x-ray them and do an adequate case history, an adequate examination, and follow-up examinations and follow-up x-rays. I have never seen those persons save money. I have never seen that. And if we bring up the next slide now, we can see how this is compromised here. What you have in front of you now is a person on your far left that is normal, somewhat normal posture, and then if that spine is injured, or if there's a hereditary propensity there, then they start to develop that rounding between the shoulders. And then on the third one on your far right, you see how it gets worse. And you see these people walking around. And to not treat that spine with good chiropractic care is a major mistake. Number two is to treat it without proper examination and x-ray is also another major mistake. Now, the next slide that we want to show you also, Dr. Jensen has something to add to this.
There's a very interesting point to this, is that they're finding that osteoporosis is not just caused that you didn't get enough calcium in life. Osteoporosis has a very definite link to having had an injury to the spine, where what's happened is you have inflammation within the bone, particularly within the marrow of the bone, that's been caused by that. And that inflammation there has been the trigger to change those cells that build up bone, which are osteoblasts, changes them into osteoclasts, which tear down the bone. And therefore what happens is inflammation-induced osteoporosis due to the injury. So in order to stop that from happening, it's much better for us to get rid of the irritation that's causing that, of which chiropractors are very well versed at doing. In fact, research shows that we're very well versed at doing that.
So we're basically saying that it is highly probable that if a person has been in a whiplash injury or some trauma to their spine, they are going to have, it is possible for them to have a propensity towards osteopenia and osteoporosis over a period of years.
Over a period of years, yes.
And if that spine is not, if the issues within the spine are not corrected or reasonably treated, we could assume that there is a possibility that they could have worsening not only health problems, but including osteoporosis as time goes on.
Absolutely.
Wonderful.
Absolutely.
So,
as we showed in that one slide, where they could not necessarily that it's going to kill them, that their heart doesn't have enough area to beat, that the body is going to adapt to that somewhat, but it's certainly not beating to the efficiency that it could.
And I think that next slide really is a good example of that. What you're going to see here is on your far left, you see a gentleman who has one of these classical kind of humpback spines, also has a scoliosis when you look at it from the right. And so being bent forward like that, that encroaches on his heart, as Dr. Jensen was showing you on that x-ray of the scoliosis sometime there a few slides ago. It also puts pressure on what they call the arch or the knob of the aorta. That's the main artery coming out of the heart. So when we're bent forward like that, that encroaches on the heart and the top of the aorta there. Thus the heart has to push harder to get the blood out through the thoracic aorta. When the heart has to push harder, the blood pressure goes up. So the person doesn't necessarily have to have some organic disease within their heart that's causing the high blood pressure. It's the spinal curve that's causing it. So every time when we get films back, and none of our films, we send all of our films out. If your chiropractor has x-rayed you and does not send your films out to a radiologist for reading, I think it's a mistake. I really do. It doesn't save money. It ultimately costs, because they can see on those x-rays then if there is encroachment on that thoracic aorta. The x-ray is going to show that on a spinal x-ray. And if it's causing this knob of the aorta to be encroached on. So it doesn't surprise us then when that person comes in and gets adjustments and some good muscle work to stop minimizing that curve so they're not bent forward like that or to the side, that their blood pressure goes down. And they no longer have a need for high blood pressure medication.
Right? Or, yes. Yes. If we look at this next slide, we actually show the inside of what we were looking at in that slide before, where you can see that this particular person, the reason why they were hunched over here is because of the collapse that has occurred to some of these vertebrae from osteoporosis, whereas you have the normal block structure here. And by the way, you can see osteoporosis in that you can just see the end plates of these vertebrae and not really the insides of these vertebral bodies. But then you come up here and some of these vertebral bodies are actually, rather than being a big square, are actually almost coin-shaped. You almost think that that's the disc, but that's actually the vertebral body. And so form follows function on this, and it's just having that curvature there permanently. Now, the other thing is that this is that scoliosis that's going on up here, and there's that knob of the aorta you were talking about. Now, if the pressure goes up, where the heart's pumping through this knob, what happens is the body tries to shore that up and make it stronger, so it puts calcification in there. So now you're talking about atherosclerosis that starts within that knob. And when it's atherosclerotic like that, where it has calcium buildup in there, arteries are meant to be able to respond to that pressure.
The elasticity of
the elasticity of it, such as when you're feeling the pulse. Okay, so all of a sudden, if this is all atherosclerotic and it no longer can have that elasticity, then what are you doing with the blood pressure there also? Is that it's causing it to increase as well.
And you can put a balloon in there and a stent in that coronary artery or that thoracic aorta or abdominal aorta, and that's a good idea to do that. But we know that stenosis also occurs, that it starts filling back up with plaque again.
Right.
Well, the thing is, even if they have to have the surgery, which is very often life-saving surgery, they should be complemented with good chiropractic care.
Yes.
Because you're dealing, the atherosclerosis and the high blood pressure is a symptom of something, a functional problem very often within the spine and the diet.
Right.
Both.
Right.
Both. You
Right.
know.
So if you're looking at the tires of your car, and they tend to wear out, the treads tend to wear out, it's not always that the tire is the problem. It could be the tie rods, it could be the suspension, it could be a number of other things. But if all you look at is the cause and keep replacing tires, you're going to continue to replace tires if you haven't taken care of the rest of the problem. And that's what we try to do.
So let's then take a look at the heart itself, all right? We've got a nice slide of that. What you're seeing here now is a cross-section of the heart, and we see all of the different chambers, and Dr. Jensen is going to point out the aorta to you here, which we've been talking about. So the heart is a big pump, and there's the aorta, and if this person has a curve up in their upper back and their lower neck, it's going to encroach. It's going to put pressure on that aorta, and it's going to restrict the amount of blood supply going through there, thus elevating the person's blood pressure. Also, if that pressure is on that aorta for a significant period of time, we're talking about months and years now, the aorta is going to get weak, so the body's innate intelligence says, look, we've got to strengthen this aorta, so it starts filling in with plaque to try and strengthen it. Well, as the plaque continues to grow and becomes thicker, that further restricts the blood supply going through there. So that's very, very significant. Anything to add to that, Dr. Jensen, before we go back to neck injury symptoms?
No, I think that
right.
covers it pretty well.
Let's talk about some symptoms of neck injuries that are classical that we see in our chiropractic clinic.
Okay. So first of all, neck injury symptoms. You're looking at head and neck pains that can occur. A lot of times, the head pain can almost be like a hood that's covering the head, if that's due to just the spinal nerves, or if you're looking at the muscles and how they can create it so it almost comes up over to the eyes. It's a number of different injuries, and what we do is we look at those pain patterns to see what the injuries actually are caused from.
So any chiropractor, physical therapist, massage therapist who doesn't take an adequate entrance case history, we're wondering about the quality of care there, right?
Right.
We're questioning it.
Right, right. And so then we want to look at another thing that we've talked about in the past show is cognitive dissonance. And cognitive dissonance is a change in how you're processing things. One of the big changes that we look at is, well, if we want to go a little bit deeper than just the injury that occurs to the brain that has changed that, is also from point is when a person is dealing with pain. They actually deal with a lot more of, they're wasting a lot more of their neurotransmitters, such as serotonin. Serotonin is the one that makes you feel like you're all is well with the world. Well, it also deals with your digestion a great deal, with creating the movement of the small intestine. So next thing you know, their intestines aren't moving well, so they have what they call adynamic ileum, which ileum is the small intestine, the name for the small intestine, and so their digestion is all messed up. Okay. Then also, you're finding from that point of view, they actually go into a little bit of a slight depression because of the abnormal use of serotonin and not really building it up as fast.
So then we could assume that there are people under psychiatric or psychological care, under religious care, spiritual care, under prayer, and that's not necessarily wrong. But we could assume that the psychological issues that they're dealing with could have also be caused in part by problems in the neck.
They may certainly have a physical contribution that is creating that beyond the psychological and spiritual basis.
But the psychologist and the psychiatrist have then tunnel vision, like many chiropractors have tunnel vision.
Sure.
Or surgeons have tunnel vision, or a classical example of tunnel vision is dentistry. You know, they just think teeth, you know.
And so, you have to look.
Many of them just think teeth.
Right. Well, you have to look at where you're trained. If you're the guy on the construction site that has been trained to use a hammer, all you see is where a nail has to go in. If you're the guy who's been trained with a screwdriver, all you can see is where the screw has to go in. And so many times that tunnel vision keeps you from looking at all different aspects of care. And so in this case, we're just looking at this may also be a contribution to that. Shoulder and chest pain is something else that can come from the neck injuries.
Because of the nerves coming out into the shoulders.
Because of the bundle of nerves that are coming out from the neck to the shoulders and to the arms. However, it could also be neck injuries. There's also muscles in the neck. And the neck is attached to the shoulders. And messing up all the different leverages that have to occur in there can also cause further injury that's actually in the shoulders as it's trying to compensate for what's going on in the neck. So many times as we look at people, they have posture like this. Well, now, if you hold your body like this for a long period of time, such as when you're on the phone, remember how we used to see a lot of injuries from people on phones like this. Now they're having headsets. But they'd have a spasm that would start from holding the muscle like that for so long, and that it wouldn't release.
Still getting radiation at their brain.
Yeah. That goes into a whole different subject. So we're also looking at that bundle of nerves also goes down thugh the arms and to the hands.
It's called the brachial plexus. So
the brachial plexus.
Maybe we should talk a little bit about the brachial plexus and the lumbar plexus. So they're basically what? Roots, like the trunk of a tree. Brain is the electrical generator. Spinal cord is the main power line. But then we have a plexus of nerves, like a bunch of roots coming out in the lower neck and upper back that supply the upper extremities. And we have another one, the lumbar or lumbosacral plexus, comes out to supply all of the nerves down into our lower extremities.
Right, right. So there's a lot of injuries that can take place. There's long-term effects of whiplash injuries that can be there. And so we want to look at that, and maybe we'll look at that further in a further show as we wrap this one up. And we find that you want to seek out just more than just underneath the surface on these things. And that's what we're here for. We hope good health to you, and please join us for further shows on this topic.
Fellowship of Relaxation.